Balancing Innovation and Integrity, Artificial Intelligence Ethics and Behavioral Health. Part 1 of our three-part series gave us a great introduction to artificial intelligence, AI, and the role it plays in patient care. Part 2 covered how AI is being integrated into electronic health records across behavioral health organizations, and today we're going to look at AI ethics in behavioral health. By the end of this session, we will be able to identify key ethical concerns and risks associated with AI tools such as bias, transparency, consent, and accountability, evaluate real-world challenges and limitations of current AI applications in behavioral health settings, understand the potential benefits of AI in behavioral health, including clinical, operational, and equity-related advancements, explore best practices for the responsible and effective integration of AI into behavioral health organizations, and apply practical considerations for selecting, implementing, and monitoring AI tools that align with clinical needs and organizational values. Before diving into specific concerns, let's take a moment to reflect on what ethical practice really means. Ethics matter because they protect vulnerable populations, preserve trust, and help us avoid harm as we adopt new technology. These quotes highlight a simple truth. Technology doesn't exist in a vacuum. It reflects human intent, design, and oversight, or the lack of it. As AI becomes more integrated into care, we must stay just as focused on the ethical questions as we are on the technical ones. As we explore the growing role of artificial intelligence in behavioral health, it's important to recognize that with innovation comes responsibility. While AI offers tremendous potential to support care, it also introduces new ethical challenges that we must address thoughtfully. Though we know we can't cover them all, on the following slides we'll walk through some of the key ethical concerns and issues of AI use in behavioral health. Ethical concerns in AI for behavioral health. Privacy and data security. Behavioral health data is among the most sensitive types of personal information. If AI systems fail to safeguard that data, the consequences can be serious, ranging from stigma and emotional harm to legal violations. Ensuring HIPAA compliance and strong governance is non-negotiable. Bias and fairness. AI reflects the data it's trained on, and if that data contains societal biases, the technology can reinforce or even amplify them. This puts marginalized populations at risk of receiving inaccurate or unequal care. Ensuring diverse, representative data sets and ongoing auditing is essential. Accuracy and reliability. Behavioral health relies on empathy and nuance, two things AI still struggles to capture. If we over-rely on AI without human oversight by qualified clinicians in this context, we risk flawed diagnoses and misguided treatment recommendations that could ultimately harm patients. Transparency and explainability. Many AI models operate as quote-unquote black boxes, making decisions without providing clear reasoning. For patients and clinicians to trust and challenge those decisions, we need transparency and explainability built into the tools we use. Informed consent. Consent isn't meaningful unless it's informed. Patients must clearly understand when and how AI is being used in their care, when data is collected, and what risks are involved. This goes beyond a checkbox. It's about open and honest communication. Accountability. If something goes wrong, who is responsible? The developer? The clinician? The organization? AI introduces complex accountability questions that must be addressed to avoid a diffusion of responsibility and to protect patients and providers alike. Dehumanization of care. Therapy is built on human connection. If we lean too heavily on AI, we risk weakening the personal, empathetic relationships that are central to healing. Technology should enhance, not replace, that connection. Autonomy and coercion. While AI may suggest options, those suggestions can feel directive, especially to vulnerable individuals. It's important to ensure that AI tools support, not pressure, patient decision-making. Data ownership and commercialization. Behavioral health data has become a commodity. Some AI tools collect and sell this information beyond the bounds of clinical care, often without patients realizing it. That's an ethical red flag, and it demands transparent, proactive consent practices. Regulatory oversight gaps. Many AI tools used in behavioral health aren't regulated by the FDA or similar bodies. That lack of oversight raises concerns about safety, consistency, and trust, especially when these tools influence diagnosis or treatment. Scope creep and mission drift. AI tools may be introduced for simple administrative tasks, but gradually start influencing clinical decisions. If this transition isn't properly managed or disclosed, it can undermine the quality of care and create ethical blind spots. Digital divide. Access to AI-driven care isn't equal. Patients and providers in rural areas or those with limited digital literacy may struggle to engage with these systems. Without thoughtful design and support, AI could widen health disparities rather than reduce them. Clinician well-being. Finally, we must consider the impact on providers. Being forced to use AI tools that contradict their clinical judgment can create moral distress and burnout. Clinicians need the ability to challenge or opt out of AI guidance when necessary. This article highlights real-world ethical and legal issues with ambient listening AI tools like DAX Copilot. A key concern is AI hallucination when the system generates inaccurate notes. Even if the error goes unnoticed, the clinician remains legally responsible, which can be dangerous. Consent is another issue. Patients may not fully understand they're being recorded or how their data is used. As we covered in our previous presentation, Beyond the Chart, AI and Behavioral Health, consent must be clear, specific, and allow opt-out without impacting care. There are also privacy risks, especially when tools create both audio and text records, raising HIPAA and legal concerns like spoliation. Clinicians may develop automation bias, over-trusting AI outputs without double-checking, and many of these tools lack FDA oversight even as they're widely adopted. These tools offer promise, but only if paired with strong oversight, ethical safeguards, and informed implementation. AI in behavioral health brings serious ethical concerns like privacy, consent, and automation bias that we must not overlook. But there's also a powerful upside. AI has the potential to expand access, improve efficiency, and support more personalized, inclusive care. So now let's shift gears and explore how AI is already creating positive change in behavioral health settings. Despite the challenges, AI offers real advantages in behavioral health. It reduces clinician burden by automating documentation and admin tasks, freeing up time for patient care. It supports clinical decision-making by identifying risks, patterns, and treatment insights for better outcomes. It expands access to care through 24/7 support with chatbots and remote tools aiding in underserved areas. It enhances data and outcomes tracking, which drives measurement-based care and population health insights. And it promotes consistency and equity, which offers objective recommendations that may reduce human bias. This study is a great example of how AI can be embedded directly into hospital workflows to support behavioral health. The AI screening tool analyzed electronic health records to identify patients at risk for opioid use disorder, something that's often missed in busy hospital settings. Not only did it help connect more patients to addiction specialists, but it also reduced 30-day readmission rates by nearly half. That's a significant outcome, both in terms of patient safety and healthcare costs, saving an estimated $6,800 per avoided readmission. This shows how AI isn't just theoretical. It can drive real, measurable improvements in behavioral health treatment access and efficiency. This is another real-world article highlighting how AI can help reduce health disparities for individuals with intellectual and developmental disabilities, or PWIDD, who often face major barriers to care. AI tools can support communication by simplifying medical language, generating visuals, or enabling speech-to-text or sign language translation. Wearables or smart home tech can monitor health and promote independence, while AI concierge tools help with tasks like scheduling and refills, especially helpful for those who struggle with standard portals. AI also supports clinician training through simulations and feedback, improving provider comfort and reducing bias. Finally, predictive analytics can help tailor care and anticipate risks, offering more personalized, proactive treatment. These innovations benefit PWIDD and enhance care for everyone through universal design. We've looked at both the ethical pitfalls and promise of AI in behavioral health. Now the focus shifts to responsibility. In this next section, we'll walk through key considerations and best practices for responsibly integrating AI into your behavioral health organization. Responsible AI use, ethical considerations, and best practices. First, center AI around clinical judgment and patient-centered care. AI should assist, not replace, clinical decision-making. And clinicians must retain final responsibility. Shared decision-making with patients is essential. Second, identify clinically relevant use cases. Prioritize tools that are evidence-based and clinically tested. And focus on specific, validated applications such as triage, symptom monitoring, and risk prediction. Third, prioritize informed consent, privacy, and transparency. Clearly explain what AI tools do, what data they access, and how they impact care. Obtain specific, informed, and ongoing consent, especially for tools like ambient listening. Ensure compliance with HIPAA, GDPR, and 42 CFR Part 2. Define access and data retention policies for AI-generated content. Ensure a signed Business Associated Agreement, or BAA, is in place with all AI vendors to uphold legal and ethical standards for handling PHI, promoting transparency, accountability, and client trust in data use. Responsible AI use continued, you will also want to use representative and ethically sourced data. Choose tools built on inclusive representative datasets to avoid demographic/systemic bias. Continuously evaluate for algorithmic bias in high-stakes areas like diagnosis or suicide risk alerts. Validate and monitor performance locally. Conduct real-world testing prior to full deployment. Monitor accuracy, false positives/negatives, and performance drift. Set KPIs and create ongoing feedback loops. And address legal, ethical, and accountability risks. Define and document how AI-supported decisions are made, ensure human oversight for critical decisions, and track AI suggestions, clinical overrides, and potential malpractice risks. Our final responsible AI use slide contains these points. Involve staff and patients in design and evaluation. Engage clinicians and patients early to build buy-in and refine usability. Provide comprehensive training on AI's capabilities and limitations. Integrate thoughtfully into clinical workflows. Ensure EHR and clinical system compatibility and avoid adding to clinician burden. AI should reduce screen time, not extend it. Align AI use with equity and access goals. Use AI to reduce health disparities, not exacerbate them. Monitor how AI tools affect treatment outcomes across race, income, gender, and disability status. Establish governance and oversight structures. Form an AI oversight committee that includes clinical, IT, compliance, and patient representation. Regularly review tools for unintended consequences and alignment with organizational values. Key takeaways. As we've seen throughout this presentation, AI holds real promise for improving behavioral health care, from increasing access to supporting clinical decisions. But realizing that potential requires ethical vigilance at every step. Transparency, informed consent, privacy safeguards, and equity must guide implementation. AI is a tool, not a replacement for human judgment. It should be integrated in ways that support clinicians, empower patients, and enhance care, not compromise it. At the same time, we must remain aware of the risks. Biases in data or design can unintentionally reinforce disparities if we're not careful. That's why thoughtful, transparent implementation is essential, and diverse, representative data and outcome monitoring are critical. Integration must be thoughtful. Prioritize clinical relevance, EHR compatibility, patient-centered design, and staff training. And ultimately, it all comes down to trust. We build that trust by being accountable. for how AI is used, how data is handled, and how care is delivered by documenting AI-supported decisions, tracking overrides, and evaluating performance continuously. In the end, when guided by ethics and empathy, AI becomes not just a tool, but a partner in delivering more compassionate, equitable, and effective behavioral health care. The future of behavioral health isn't just about innovation, it's about intention. And how we choose to implement these tools will shape the care we provide for years to come. Thank you so much for your time, attention, and commitment to ethical, patient-centered innovation.